Good afternoon, doctors. Welcome to this webinar on role of Oseltamivir in flu management. This webinar is brought to you by Hetero Healthcare. Hetero Healthcare is an innovative pharmaceutical company. Our journey began in 1993 with 30 years of excellence and 36 state-of-art manufacturing facilities. Hetero Healthcare has 300 plus products in portfolio and presence in 126 plus countries. Hetero Healthcare has 21,000 employees globally and is the largest closely held pharmaceutical company in India. Hetero Healthcare is among the largest manufacturers of ARV, APIs, and FDFs in the world and has Asia's largest API manufacturing facility at SEZ Complex, Visakhapatnam, Andhra Pradesh. Hetero Healthcare is 360-degree solution provider, striving to fulfill unmet healthcare needs, reaching to customers across India with wide product range encompassing multiple specialties, pioneering in quality and innovation, and has the distinction of bringing 4 biosimilar products to market within 5 years of initiation. They are darbepoetin alpha, rituximab, bevacizumab, and adalimumab. During COVID-19 pandemic era, Hetero Healthcare, the pioneers in antivirals, offered Oseltamivir, Favipiravir, and Remdesivir to the patients, because of which in August 2020, they received an award of Pharma Excellence for COVID drugs. Today's webinar, role of Oseltamivir in flu management, we have got moderator Dr. Kapil Rathi, sir. Welcome, Dr. Rathi. Dr. Kapil Rathi is medical director and consultant at My Health Clinic since December 2006 till date, working in general and critical care management for 19 years and is well equipped with all the general medicine, chest medicine, and critical care products. Awarded by Governor of Maharashtra for excellence in work during COVID times, Sir has been part of trials for MNC and National Pharma in phase 2 and 3 trials, working with various NGOs for health awareness by conducting camps. And Dr. Rathi is fellow of infectious disease by IDSA, member of ERS, ATS, ACP, IDF, ADA, RSSDI, and ICP, and has held multiple positions in various bodies. Over to you, sir. I will run the slides, sir.
Okay, thank you. I hope I am audible and visible both.
Yes, sir, you are audible.
Okay. So thank you once again, Team Hetero, for inviting me, and thank you, Dr. Prashant, for that kind introduction. So let's begin our journey for use of Oseltamivir in a flu management. This is not very new topic, but this is a very important topic for all of us because of the current health scenario and current season which is going on. So my flow will be, what are the challenges in monsoon and their diagnosis? What is flu? How they are important? What is the complications? What are the drugs which are available? The people will talk more on Oseltamivir, and obviously, does guidelines support this empiric use of Oseltamivir? That is what we are going to discuss next. So this is going to be very crisp and very, I like all my audience to put some questions at the end of the talk so that we can have a good discussion, so that we learn from each other. So healthcare related challenges in monsoons are influenza like H1N1 or severe acute respiratory illness, what we call SARI, and COVID-19. COVID-19 mostly is done and dusted, but flu remains to be there like a pandemic or like an epidemic more or less every year, every season. And that is going to be there for n number of years to come. And obviously, some of them will be bad like H1N1 or H3N5 or whatever, and it will cause a lot of severe pneumonias and, hospital admission. Most of our flu, 80% or 90% of the flu will be on OPD basis, and mostly they are very easy to treat. Next slide. So this is the wide variety of Indian data, what we have got right from 2017 till 2022, what they say that has been there. Flu is not a very simple benign disease. It can cause catastrophe in the form of death, and the cases are being on rise. In fact, they are more rise in last couple of years because of climatic changes, because of environmental pollutions and not others things. And obviously, more awareness amongst the general practitioners and the physicians to pick up flu early and treat them very fast. Next slide. So there is a lot of data. Now, if you see overview of this influenza or flu in India, if you see the green bar, which will actually depreciate the 2019. So from 2015 to 19, the cases of influenza are being on rise, if you can see this. And obviously, the death rate has also gone up substantially. In fact, it has gone down 5 times from 2015 to 2019. So that says that flu virus has been changing over a period of time and it's becoming more fatal. Next slide. So if you see in the next slide, the types of influenza viruses, there are basically 4 types, A, B, and C, and D. C and D are not for practical purpose or use for clinician. C causes very mild variety of disease, and D are basically in the mammals, especially in the monkeys and the cattle. What we are worried or what we treat is basically influenza A and B, And out of that, A is most common and most important for all of us because this A virus can causes you major pandemic which health across. If you see the history of flu virus in last 100 years, all the pandemics are caused by influenza A. And influenza B is it does happen in human being, but it's a very mild kind of a virus, so it doesn't causes much of a pandemic. It can cause a local epidemic, which can be very sustainable. So these are the types of influenza virus what we deal. Next. So if you see how does transmission of flu virus happen, it generally spread from people to people. It's a very contagious. It's a nasal spray. It's a it's a same like what happens in environment. Once you cough down, your virus gets suspended in the air, and they can transmit that virus, which is in the range of 6 to 8 feet, and it generally has a droplet kind of an infection, and this droplet can go from your nose to your upper to your lower respiratory infection and can cause illness which is a typical flu illness. So the most important thing is hygiene, probably hand hygiene, probably environmental hygiene and personal hygiene. And obviously, you need to be away from the infected person as far as possible for at least first 3 4 days when the virus is in the peak for the transmission. So that is very important. Generally, these viruses are self-limiting. They generally, give little trouble to the patient for 5 to 7 days, and after 7 days, probably they can be treated on their own in most of the cases. But in children, it can go for a beyond a week. It can go up to 2 weeks. So that is very important because child immunity is little different as compared to adult immunity. So one has to treat the virus. They have to treat in first 3 or 4 days. That is most important. That is why this cycle is very important. Next slide. I hope you understand till now what we are trying to discuss. Now, if you see the symptomatic differentiation between influenza-like illness, H1N1, SARI, and COVID-19, this is the most important slide. If you see fever, myalgia, cough, lack of energy, sore throat, they are very common. They are common in all viral infection which causes respiratory illness. But breathlessness, very common with H1N1, SARI, and COVID that was seen. Loss of taste and smell was very typical with COVID, not with other. Diarrhea was very typical with alpha variant of COVID, not with other. And headache may be present in some or other cases. So if you see the signs and symptoms are very vague for all the flu illness. So you cannot differentiate clinically whether it is ILI, H1N1, SARI, or COVID. So that is very important. So you have to treat them very aggressively, uh, you know, uh, thinking that it might be a little more lethal virus. So that is very important. Next slide. But there are some particular, some signs which are associated with COVID and some with SARI. So what are the emergency warning signs of flu sickness? Obviously, simple cough, cold, fever, some bluish discoloration, not being comfortable, little hacking cough, little body ache, myalgia, which are very common in adults. And in children, it can be, typically irritability or sometimes, fever which is not getting down, very fast breathing, very tachypneic and something like that. And on top of that, typically loss of, the anorexia is very common in flu-like illness. The muscle and calf pain is very common in flu-like illness. And sometimes it happens that patient will have, a lot of lethargy, which is very common in a flu illness. Next slide. So these are some typical signs what we can do. And then there are complications of flu, what we are trying to discuss. Why we are discussing flu? Next slide. Because in complications, you can see you can have pneumonia, bronchitis, ear infections, ARDS, a lot of worsening of asthma, COPD, and obviously, last but not the least, you can have death. So these are a wide variety of complications which can happen with flu. So that's why it is very important for all of us to treat flu. इसके लिए फ्लू को ट्रीट करना जरूरी है क्योंकि फ्लू कभी कभार आपको इन सीवियर डिसीजेज में भी तब्दील हो सकता है, चाहे वो डेथ हो, ARDS हो, विच इज अ वेरी कॉम्प्लिकेटेड केस. Simple flu can go into a severe infection. Next slide. So that's why we need to treat flu. So how do we treat flu? Very simple. सबको पता है कैसे ट्रीट करना है वायरस को, बट जो 2-3 चीजें जो इंपॉर्टेंट है वो मैं आपके साथ में डिस्कस करूंगा. बस मोस्ट इंपॉर्टेंट ट्रीटमेंट इज बेड रेस्ट, लॉट ऑफ वाटर विच पेशेंट नीड टू टेक, cough suppression, symptomatic treatment, antipyretic, sometimes maybe painkiller. These are all very symptomatic medicines. Most of the influenza, I should say 60-50% of influenza will recover in 3 days. However, there might be malaise, there might be fatigue, there might be lethargy for 5 to 7 days in the patient. But severe cases may require a lot of IV fluid and other supportive measures, which are, so the flu had been divided into category A, B, and C. So let's see what this category are. Next slide. So if you see, category A means patient is very simple to treat. Category B means patient will have some kind of difficulty in breathlessness, which can be treated in OPD. But category C is something where patient is very severe and need to be hospitalized. So what are the treatment which are available with us as an antiviral drug? We all know antibiotic, we all know, antifungals, we all know all other things, but a lot of people don't know antiviral drug because हमको किसी ने बताया नहीं, हमको कभी कॉलेज में, मेडिकल कॉलेज में या कभी डिस्कशन कभी हुआ नहीं, जब भी हुआ तब बोले कि सिंपल ड्रग है, कभी यूज करना है तो करिए, अदरवाइज मत करिए. So that is the concept of antiviral. But after COVID, what we have learned, and obviously over a period of time, as we grow old in our practice, हमने देखा है कि एंटीवायरल भी उतने इंपॉर्टेंट है जितने कि एंटीबायोटिक और एंटी फंगल और अदर ड्रग्स है. सो एंटीवायरल में टिपिकली अगर आप ट्रीट करने जाओ फॉर फ्लू और आई एम टॉकिंग राइट नाउ, देयर आर टू ड्रग्स. वन इज न्यूरामिनेडेज इनिबिटर, जो कि सबसे इंपॉर्टेंट है और बहुत कॉमन ड्रग है, और दूसरे एडमेंटिन्स विच आर M2 आयन चैनल ब्लॉकर्स. इसके एग्जांपल्स है एमेंटाडीन एंड पेमेंटाडीन. So neuraminidase inhibitors, what they does, they block the neuraminidase protein or enzyme which is very critical in releasing the virion from the infected host cell. मैं next slide में आपको बताऊंगा कैसे ड्रग काम करता है और क्यों काम करता है. And these drugs are very active against influenza A or B. The example is Oseltamivir. The brand name is Fluvir by Hetero. And second is Zanamivir, which is an inhaled drug जो nebulized form में हम लेते हैं, उसको बोलते हैं Zanamivir. ये भी अवेलेबल है इंडिया में, लेकिन Oseltamivir बहुत easy, बहुत सिंपल और बहुत इजीली अवेलेबल ड्रग है जो हम दे सकते हैं, वेरी सिंपल टू यूज. While advantines, which are M2 ion channel blockers, they interfere with hydrogen ion channel activity of the influenza virus, thus blocking entry of virus into host. तो ये क्या करते हैं, चैनल होता है M2 आयन चैनल, जो कि दवाइयों, जो कि वायरस और होस्ट सेल के बीच में एक चैनल होता है जिसके थ्रू वायरस अंदर एंटर हो सकता है, उसको रोकता है. तो बट द बैड पार्ट इज दैट इट ओनली हैज गॉट एक्टिविटी अगेंस्ट इन्फ्लुएंजा ए, इन्फ्लुएंजा बी के साथ में इसकी एक्टिविटी नहीं है. तो ये इसका थोड़ा सा डिसएडवांटेज है. एंड ड्रग का डोजिंग थोड़ा सा गड़बड़ है और ड्रग थोड़ा सा वीक ड्रग है एज कंपेयर टू neuraminidase inhibitor. So examples are amantadine, which is available in the market. Next slide. So just we'll talk about oseltamivir. Next slide, please. So oseltamivir is a very potent and selective inhibitor of neuraminidase enzyme of the influenza virus A and B. It is a prodrug which get converted into active forms like oseltamivir carboxylate in the liver. It inhibits influenza virus replication and pathogenicity, very important, and it prevent further spread of infection. That is most important because वायरस को अपने बॉडी में ही रोक दिया या जो स्टेज थी वहीं पे रोक दिया, सो आपका पेशेंट बिकम्स डिसइंफेक्टेड. ये पेशेंट और किसी पेशेंट को जनरली इन्फ्लुएंजा नहीं देगा. सो दैट इज वेरी इंपॉर्टेंट. So this is for treatment as well as prevention. It is effective against all strains of A and B, which includes either flu virus, either avian, either swine, either H9N2, H1N1 या H5N1. सभी कैटेगरी में काम करेगा इन्फ्लुएंजा ए वायरस के, बिकॉज न्यूरामिनेडेज इनिबिटर है जो कि हर ए और बी वायरस पे होता है. नेक्स्ट स्लाइड. तो दिस इज ओसेल्टामाविर. तो इफ यू सी दिस मोड ऑफ एक्शन ऑफ ओसेल्टामाविर, अगर आप स्लाइड आप ध्यान से देखेंगे तो एक वीरन होता है जो आपको दिख रहा है स्टार के जैसा. उसके अंदर में आप देखोगे येलो कलर के मशरूम जैसे बीडिंग है जिसको हम न्यूरामिनेडेज बोलते हैं, और एक ब्लू कलर के स्पाइक्स है जो हीमोग्लूटिन है. अब हर वायरस के ऊपर में, फ्लू वायरस के ऊपर में 18 प्रकार के हीमोग्लूटिन होते हैं और 11 प्रकार के न्यूरामिनेडेज. सो इसकी वजह से ही जब कॉम्बिनेशन होता है तो H1N1, H का एक पार्ट होगा, N का एक पार्ट होगा, और उसको मिला के वायरस का एक लीनिएज तैयार होगा. दैट्स व्हाई यू गेट ऑल दिस मल्टीपल काइंड ऑफ infections with flu like H5N1, H1N1, H1N3, H3N5. So typically H1N1 typically was with the swine flu. So this drug what does, oseltamivir क्या करता है, ये जो आपको जो डम्बल शेप के या जो आपको मशरूम शेप के जो न्यूरामिनेडेज दिख रहे हैं उसके ऊपर में जाके ये इस न्यूरामिनेडेज एंजाइम पे जाकर ये ड्रग जाके बैठ जाता है और उसको ब्लॉक कर देता है. What it does, it then prevent the release of new viral, therefore it will decrease the production of virus and it will decrease the spread of it. So that is very important. So if you got, अगर आप नीचे का स्लाइड देखोगे तो ये जो ड्रग हमने दिया है वो जाके उस मशरूम शेप पे जाके बैठ जाएगा और वो विरियन को रिलीज नहीं होने देगा, जिसके वजह से आपका वायरल रिप्लिकेशन बंद हो जाएगा और वायरस वहीं पे नहीं खत्म हो जाएगा और आपकी बीमारी आगे नहीं बढ़ेगी. So that is very important. So this is the most important slide. How does oseltamivir work? Next slide. I hope it is very clear for you. Now this is approved by all the societies like FDA, AAP, CDC, everywhere. It is available in more than 100 countries in the world. So ऐसा नहीं कि ड्रग खाली इंडिया में, तो पूरे दुनिया में अवेलेबल है. It is one of the most important drugs to be used as an antiviral. Next slide. So the doses and recommendations हाउ डू वी यूज? बहुत सिंपल है. अगर आपका वजन 40 किलो के ऊपर है तो आपका सिंपल डोज है 75 मिलीग्राम दिन में 2 बार आफ्टर फूड फॉर 5 डेज. So if you see technically 3 milligram per kilogram per day. So that is very important. So अगर if you are more than 40 kilo, the drug dose is very simple till the time you are 100 kilo. If you are less than 40 kilo, then the doses will be depending on the milligram per kilogram. So that is very important. So you can have 60 milligram if your weight is less than 15 kilo. You can have 90 milligram. The weight is between 15 to 20 kilo. You can have 120 milligram. The weight is between 23 to 40 kilo. And you have to divide the dose in two doses, morning and evening. So that is very important. Same चीज syrup में भी available है, so that's a good part. So you can use in pediatric population. You can use in patients who cannot take orally tablets. Also, you can use in the patients who are sick, who are on RT fits, who are in critical care unit. You can still use via an RT tube. So that is very important. So dose remember करिए 3 मिलीग्राम पर किलोग्राम दिन में 2 बार ही आपको देना है. So अगर आप 50 किलो के हैं for example, so the dose becomes 150 milligram. So that is 75 milligram दिन में 2. That's simple. Next slide. So what are the benefit of empirical use of oseltamivir? So oseltamivir not only decreases lower tract infections, but it also decreases unnecessary use of hospitalization. हम लोग सभी लोग कोई भी पेशेंट आता है तुरंत एंटीबायोटिक शुरू करते हैं, हम एंटीवायरल के बारे में सोचते ही नहीं है. तो दैट इज वेरी इंपॉर्टेंट. सो बहुत सारे पेशेंट को शायद एंटीबायोटिक नहीं लगेगा, एंटीवायरल में भी काम हो जाएगा, लेकिन हम ऐसा नहीं सोचते. तो अगर आपने टाइमली इफ यू गिव एंटीवायरल, probably you will reduce the uses of antibiotic, which is unnecessary in most of the people. That is very important. Therefore, it can not only decreases the use of antibiotic, but also it will decreases the hospitalization. That is very important. So you can reduce your antibiotic doses or uses by almost close to 30%. It can decreases lower respiratory infection by close to 60%, and it will decrease your hospitalization by 60%. Believe me, these are huge numbers. This can save a lot of money of the patient as well as the health organization. Next slide. So this is the importance of using right timely oseltamivir. Obviously, there are a lot of cohort, or there are a lot of data to support that severity of pneumonia due to H1N1 was decreased once you use once you use oseltamivir in H1N1 positive patient. And there was a lot of data to suggest that. Next slide. Very important to understand. The most important thing what people do wrong is basically they use oseltamivir after 3-4 days of infection. That is wrong. अगर आपको इस ड्रग का सही यूज करना है, सही मायने में करना है, तो आपको ये ड्रग इन्फेक्शन से 2 दिन के अंदर में देने में फायदा है. तो अगर आपका इसमें पेशेंट आता है बोलता है सर मेरे को लास्ट 1-2 दिन से सर्दी खांसी फ्लू जैसा लग रहा है, स्टार्ट दैट ड्रग एट दैट पॉइंट. डोंट वेट फॉर 2-3 मोर डेज, बिकॉज बाय दैट टाइम द वायरस रेप्लिकेशन हैज ऑलरेडी बीन डन. प्रॉबेबली दैट टाइम तो आपका रिकवरी फेज शुरू हो जाएगा, या दैट टाइम आपका सीवियरिटी फेज भी शुरू हो जाएगा. तो अगर आपको ड्रग देना ही है तो अर्ली दीजिए, पहले 2 दिन में दीजिए, देन ओनली मिक्स अ लॉट ऑफ डे. नेक्स्ट स्लाइड. So very important, if you see that graph also, the severity of pneumonia and the probability of pneumonia, they both goes down substantially, very importantly, as early as, maybe possibly 30 to 40% cases में 3-4 दिन में कम कर देता है. So even when administered 48 hours after symptoms, oseltamivir showed considerable potential for reducing pneumonia. That is also there. But I strongly urge all of you who are practicing general practitioner or consultant practitioner, try to use it in first 48 hours so that you get maximum benefit to your patient and patient doesn't land up in the complication. Next slide. So what does the guideline says? It is recommended by WHO. Early empiric treatment is strongly recommended. Not recommended, but strongly recommended. And treatment should be started as soon as possible. As soon as means within 48 hours, ideally. लेबोरेटरी कंफर्मेशन ऑफ इन्फ्लुएंजा इज नॉट नेसेसरी, कोई भी करता नहीं है. सारे लोग एम्पिरिकल और क्लिनिकल जजमेंट पे ही दवाई देते हैं. अगर लेबोरेटरी टेस्ट अगर आपकी नेगेटिव भी आती है, इट डजंट एक्सक्लूड योर डायग्नोसिस, बिकॉज इट कैन वेरी फ्रॉम लैब टू लैब, फ्रॉम कंडीशन टू कंडीशन, फ्रॉम पेशेंट प्रेजेंटेशन ऑल्सो. इन अ हायर रिस्क पेशेंट, इट हैज बीन एक्सपोजर टू अ पेशेंट विद फ्लू, यू कैन स्टार्ट प्रिवेंटिव ट्रीटमेंट. तो ये एक ऐसा ड्रग है जो आप एम्पिरिकल शुरू कर सकते हैं, पेशेंट में भी शुरू कर सकते हैं, और जो कॉन्टैक्ट में भी पेशेंट है, जो हाई रिस्क पेशेंट है, उनमें भी दे सकते हैं फॉर एन एम्पिरिकल ट्रीटमेंट. सो दैट इज द एडवांटेज. नेक्स्ट स्लाइड. सो अर्ली एम्पिरिक सपोर्टिव ट्रीटमेंट एंड मॉनिटरिंग इज वेरी इंपॉर्टेंट. Empirical therapy includes a neuraminidase inhibitor for treatment of influenza, but there is a local circulation. बहुत बार एपिडेमिक होता है, पर्टिकुलर एरिया में होता है, या पर्टिकुलर जिले में या पर्टिकुलर मोहल्ले में होता है, तो वहां पर आप एम्पिरिकली एक पेशेंट के अलावा बाकी घर वालों को आप दे सकते हैं टू प्रिवेंट द स्प्रेड ऑफ द इन्फेक्शन. दैट इज वेरी इंपॉर्टेंट. सो अगर किसी को ट्रैवल हिस्ट्री है, अगर किसी के घर में इन्फेक्शन है, अगर किसी के एरिया में, मोहल्ले में या पूरे चाली में, तो भी आप बहुत सारे पेशेंट को दे सकते हैं एज एन एम्पिरिकल टू प्रिवेंट द फर्दर स्प्रेड ऑफ द virus. That's very important. Next slide. In adult with community acquired pneumonia who test positive for influenza, should the treatment regimen include antiviral therapy? What is the guideline? What they say? Now that anti-influenza treatment such as Oseltamivir or Fluvir should be prescribed for an adult who tests positive for influenza. They have to start. Once it is positive, there is no second thought. It has to be given irrespective of the day of illness or irrespective of the stage of the illness, because that is very strong recommendation. Several observational studies suggest that treatment with oseltamivir is associated with reduced risk of death. Obviously, अगर आपने जल्दी शुरू किया, आप वायरस को जल्दी पकड़ लोगे, बीमारी को आगे नहीं बढ़ने दोगे और आपकी डेथ बचेगी. That is very important. And treatment within 2 days of symptom onset or hospitalization may result in best outcome. अगर आपको इस दवाई का सही मायने में यूज करना है, तो यूज within 2 days of diagnosing, so you can give the best outcome to the patient. That is what is recommended. Next slide. So to summarize, whatever we have discussed till now, proper diagnosis can always pick up your diseases very fast. Early treatment can prevent the flu complication. That is very important. And flu is like a lottery. It can give you, it can be self-limiting or it can be a self-devastating also. It can cause death also. Empirical use of oseltamivir reduces lower respiratory complication, hospitalization, and antibiotic use. I think that is the most strong statement what I can say from this slide. And WHO, American Thoracic Society, and all other society, even Ministry of Health and Family Welfare from India also recommended empirical use of oseltamivir. So what I'm talking right now is not my personal opinion. It is the guideline. It is the recommendation across the globe. The problem is that we know, but we are very reluctant, or we have got this clinical inertia not to use. So हम लोगों ने क्या करना है, ऐसा कोई भी पेशेंट अगली बार आता है, आपको लगता है कि सीजनल फ्लू है, आप ओसेल्टामाविर शुरू करिए, प्रॉबेबली आपको एंटीबायोटिक की जरूरत नहीं पड़ेगी, प्रॉबेबली आपका पेशेंट भी 2-3 दिन में काफी अच्छे से रिस्पॉन्ड करेगा. यू प्रॉबेबली यू विल सेव लॉट ऑफ मनी ऑफ पेशेंट एज वेल एज डायग्नोस्टिक्स एंड अदर. So I think this is the most important message. What I want to give is that do diagnosis early, do start treatment early, and monitor this patient so that we can give best outcome with it. I think that was the last slide. Thank you so much for the patient listening. If there are any questions, I'll be.
Yes, some questions.
Yeah.
We have received some questions earlier. Has the incidence of viral infections increased, and possible reasons?
Yes, yes. Virus is always going to get increased. It is mostly most of the time season. Now currently the winters are going on, plus the air pollution and everything is so much there. So the virus are going to be there, and they are going to get increased. So if I want to answer your question precisely, yes. And the reasons I've told you, because of bad habits, because of pollution, because of frequent traveling, and a lot of other things are there.
And generally, sir, how soon the patient is brought to the doctor, even to a pediatrician or maybe even physician?
Generally, generally that is the agony, or that is the the bad part. They generally come after 3-4 days, because
Correct.
they'll try dolo, they will try some medicine, they will try some gharguti kada and everything, and then they come to us. I think that the window what we are looking for is most of the time that is lost. But most of the time, general practitioner might get that window. So that is very important. Consultant might lose that window because they come to us after 4-5 days because GP is not able to handle them, or there is some other complication. But general practitioners get that window within that 2-3 days. And I think that is the right time where you can hit with Fluvir or Oseltamivir, and you can actually cut down the complication.
You already answered this.
Oh yes, I strongly recommend it again. Please start empirical.
Very
There is
clearly.
no harm. ये एक ऐसा ड्रग है, आप एंटीबायोटिक एम्पिरिकल चालू करते हैं, उसका कोई गाइडलाइन नहीं है, बट आप एंटीवायरल एम्पिरिकल चालू करते हैं, इसका गाइडलाइन. So nobody can touch your collar if you start oseltamivir in a patient, because that has been it has been in the guideline, it has been the legal paper.
Yes.
So I think we should do that in a given patients.
On
And you
what
don't have to
factors
wait
the
for investigation also. That is another
yes.
point. I mean, you don't have to do a swab. You don't have to do, clinical judgment is good enough.
Yes. What are the factors apart from early start on which clinical response
Yeah.
depends?
So more the sicker patient, better is the response. I always
Okay.
seen that.
Oh,
So if you got a lot of, lot of congestion, lot of running nose, lot of, typical body myalgia or, little bit of dry cough, they respond very well with this kind of thing.
okay.
सिंपल बॉडी एक रहेगा, बाकी अगर नेजल सिम्टम्स या अगर कुछ नहीं रहेगा ना, तो उतना ज्यादा काम नहीं करता है. बट इफ यू गॉट रेस्पिरेटरी सिम्टम्स इन द अपर रेस्पिरेटरी, व्हाट आई एम टॉकिंग, नॉट लोअर रेस्पिरेटरी, and you got body and headache and everything, it works very well in this kind of
Okay.
cases. So that is one thing. Two factors means obviously it is only the drug which is going to work. You should have good hydration. You should
Absolutely.
drink a lot of water.
Absolutely.
You should have some symptomatic medicines. You should rest. I think that is also very important.
Correct.
You cannot
Correct.
say, okay, मैं Oseltamivir खा लिया, then I go for work on the same day.
Yeah.
Probably a couple of days of rest, good hydration, good, sleep, and good proper medications can make you recover within 2-3 days, what we have seen.
How long, sir? You have already answered this in that
Yeah,
table.
yeah. So the recommendation is 5 days. We have gone in some cases for 10 days also.
Yes.
Depends on patient to, but
Patient.
mostly 80% of your patient will require not more than
5 days.
5 days. It is about the sicker patient what we go for 10 days.
This could be important for GPs. You should prescribe antibiotics concomitantly.
That is that's a very gutsy question. How do you deal that? But if you are damn confident that it's a viral, there is nothing else. If your CVC also indicates some bit of virus and everything, you are all the rights of not to use antibiotics.
Correct.
Please don't. I don't use. In most of my cases, if I'm confident enough of that patient, obviously you need to monitor this patient. You need to call them maybe every 2 days and see. So don't get carried away with the fever. Fever is a part of viral illness, but the continuous fever is not the part of viral illness. If there is a continuous fever, if there is something which is something which is bothering you, if there is a patient is too toxic or something, then you are justifying starting some antibiotic. But a simple fever, a little bit of sore throat and maybe body headache, please don't start antibiotic because ultimately that is not going to work also. So what you should start means basically you should start fluid in such kind of patient. That will help more rather than antibiotic. I'm not discarding you should not use antibiotic, but then you should be very rational in using antibiotic. People use antibiotically very over, over a, like a knee-jerk reaction, but they don't use antiviral, which is the need of the. So that is how that concept needs to be there. So you have to balance it out properly. But
Absolutely.
what we are trying to give you impressions that once there are antiviral, please use them very soon.
So in your patient practice, how well is oseltamivir tolerated?
Oh yes, very well tolerated. One liner answer is very well tolerated.
Yes.
Hardly we have seen any side effect. Hardly. A little bit of nausea, vomiting. That's a part of viral prodrome also. So this drug doesn't interfere with any other your cardiac drugs or any anti-diabetic or any other drug. So that's a good part. So you can give it in all your comorbid patients also very easily. And obviously these are very well tolerated. Precautions means I don't have any but obviously if you are allergic to any
Oh, yeah,
antiviral
obviously. Yeah.
previously in
Yes.
your life, then probably you will be a little skeptical in using.
Yes,
Otherwise,
of course. Yes.
it's very easy drug to use, very easy monitoring, and very easy schedule. Ek strip lena and that's it.
Bas.
There is a strip of 10 twice a day, 5 days, and that's it.
Your take-home message, sir, to the audience, overall
Oh
experience.
yes, please, for God's sake, use antivirals. Antivirals are there. They are very next door to your chemist. They are lying there. Please use them in a proper way to your patients who require that. That will help you a lot to your patient. Please don't only bank on antibiotics. Antibiotics are for bacteria, not for virus. Antiviruses are for viruses. Most of our upper respiratory infections are viral. We should know our data. We should know our locality. We should know our drugs very well. The most important strong message I want to put across all of you, there is an antiviral, there is a virus which is there. Try to use so that we can mitigate this viral infection. Antibiotic can be used, cannot be used depending on your wisdom, but antivirals you can use in the seasonal flu, in the flu, or along with your antibiotics also if you wish. But don't forget antiviral drug at the cost of antibiotics.
Thank you so much, sir.
Thank you.
Thank you so much. It was lovely sharing your experience, because your experience will further help general practitioners to identify and start oseltamivir and take care of that. Thank you so much. And thanks all the general practitioners who took time from their busy schedule and attended this webinar. Thanks, Dr. Rathi, for helping them. Thank you so much for all the technical. And thanks IT team Hitro, thanks marketing and sales team for arranging this webinar. I'm sure this has benefited the doctors who attended. Thank you so much, sir. Sir, you can sign off, sir.
Thank
We'll
you.
again see you
Pleasure.
soon.
Bye-bye.
Thank you so much. Thanks, Bhuvan. Thanks, Samruddhi.
Thank you, sir.